Hello, everyone, and welcome to the latest webcast in Caring.com's Digital Marketing Academy. Our session today is about online marketing for skilled nursing organizations. I'm Denise Graab, a marketing director here at Caring.com, and we have two featured experts, Judah Gutwein and Osmond Cook, who I'll introduce momentarily. We have a lot to cover today, so let's go ahead and get started. Before we dive into the presentation, though, I want to cover a few housekeeping items. This is a one-way webcast where only the presenters speak. However, you can ask questions, and we want you to ask questions in the upper right box of your screen anytime during the session. We're going to have a Q&A at the end of the presentation, and we're going to answer the questions then. If we don't get to your question, don't worry, we'll follow up with you afterward. No question will go unanswered, so don't be shy about asking questions. Also, one common question we get is, will this presentation be available afterward? The answer is yes. Both the presentation and the recording will be made available to you afterward, so you don't have to worry about frantically scratching notes. You can listen and ask questions as we move through it, and you will be able to revisit the content afterward. Now, while this webinar is free of charge, you do have to listen to a brief commercial about Caring.com, your sponsor of this event, as price of admission. We have 3 million visitors using our site, Senior Care Resources, every month. These are families and older adults who are turning to us for caregiving information, referral, and support. They also come to us in large part for reviews about senior care providers, including skilled nursing facilities. In fact, we are the largest senior care review site with more than 150,000 consumer reviews posted today and thousands that get added every month. We also have thousands of original articles across all caregiving and elder care topics, and we host dozens of online support groups for family caregivers. Caring.com is owned by Bankrate and is part of a powerful network of websites dedicating to supporting people in making complex financial decisions. Today's presentation features two top experts in skilled nursing marketing, and we're so thrilled to have them. Judah Gutwein is Chief Executive Officer of Sky Care Media. He has many years of experience in the creation, implementation, and marketing of high-profile businesses to the online community. In 2012, he dedicated and channeled his passion to focus on the healthcare industry. As a licensed nursing home administrator with additional years of experience as an admissions and marketing director, Judah is intimately familiar with the challenges of building and maintaining a vibrant and profitable census in your buildings. Through enhanced online and social media presence, search engine optimization, and reputation management, he can assist you in achieving your sales and marketing goals. He's also a featured editor, writer, and contributor to some of the most prestigious online healthcare resources and directories. We also have Osmond Cook. Dr. Cook is Executive Director of the Association of Skilled Nursing Providers. She received her PhD from the University of Utah in Communication and is a regular health and wellness contributor to the Orange County Register, Daily Herald, Senior Scene, Senior Housing Forum, and more. She's also currently the host of Good Day Orange County, a local television program for Laguna Woods, a senior community with more than 18,000 residents. And in her spare time, she's CEO of Osmond Marketing, a full-service content marketing organization. Thank you both, Judah and Amy, for spending your time today with us and sharing your excellent insights, which we'll get started on soon. For those of you who are not yet familiar with me, I've been at Caring.com for 7 years now, and I have extensive experience in social media marketing and in reviews in particular. I was part of the original expert panel who created our review guidelines at Caring.com, and I have been a key player in the program in the years since then, including as co-creator and manager of the Caring Stars program, which we'll tell you about toward the end. As always, we have a lot to cover today. We're going to start first with taking a step back and talking about why online marketing even matters for skilled nursing organizations, why this presentation is so important for you. Then we're going to dive into 3 core strategies, and we're going to share some case studies and success stories to inspire you. Then we're going to take your questions, and we're going to close with some key takeaways and announcements that we hope you'll stick around for. Okay, so let's get started. We're going to start by talking, like I said, about why digital marketing matters for skilled nursing organizations nowadays. Let's start with you, Judah. Why would you advise skilled nursing organizations to focus on digital marketing as a strategy for growing their business?
Thank you so much, Denise. First off, let me just say it's an honor and a privilege to share this webcast today with you, as well as with you, Amy. Thank you, everybody, for being here. It's an excellent question. As an industry insider, as a licensed administrator, I've seen the industry evolve tremendously. And where in previous years we used to rely almost exclusively on the referrals coming in from the hospitals, whether via Allscripts, CuraSpan, your traditional referral stream, those referrals have petered out to a large degree, and facilities are not just getting the same volume that they used to get. And there's a number of reasons for that. On the face of things, the hospitals today are increasingly working with their own ACOs, preferred provider networks, whereby if a facility is not part of that network, based on whatever the criteria are, they're not going to see those referrals because they're not on the list that the social worker is giving to the families right prior to discharge. At the same time, you no longer have a dynamic where the traditional relationships that screeners and liaisons were able to develop over the course of many years with social workers carry the same weight in terms of the output of referral volume. Today, hospitalists are increasingly directing traffic in terms of discharges, and the age-old relationships that used to work don't carry the same weight. You also have a scenario today where the hospitals in many cases have their own subacute facilities where subtly or not so subtly, they direct traffic to their own locations first and foremost. And so all of the desirable cases, whether financially, clinically, or a combination of both, get directed to their facilities first, and all of the other SNFs are left scrambling at the end of it to fill their beds with the residual patients who maybe weren't as desirable or a little bit trickier to discharge, whether again, financially or clinically. And finally, because folks are living longer than ever, you have a scenario today where millennials, who are very, very savvy, are very much involved in making the purchasing decision for an elderly grandparent. Those folks are typically going online to do their due diligence before they make a decision. So whether they receive the referral list from the social worker or the hospital, recommending several facilities, possibly including their own, of course, whether you're on that list or you're not on that list, inevitably, these folks are going to be going online and typing in any number of permutational search queries, looking for a post-acute care provider or a SNF provider in your area, using your keywords, what I like to say, your buzzwords. And the goal is to reach out to that demographic, to circumvent some of the traditional channels, to try and get them to engage with you for a tour and ultimately to close the sale. So for all of those reasons, I think today more than ever, the internet is critical in drumming up business and filling beds for skilled nursing providers.
Thank you, Judah. Amy, why do you advise skilled nursing organizations to focus on digital marketing?
Well, thank you again, Denise and Judah, for letting me, have a seat at the table with you two experts. I think what Judah said was excellent. And I'd also like to just add that Americans are more mobile than ever. And so in addition to being multi-generational, you also have people who are moving all the way across the country and adult children who want their mom and dad to be taken care of, but they don't live close by. So really, a lot of the time, all they have to go on is an online presence. And so that's when those reviews are becoming so important. In fact, 88% of people consult online reviews before making a purchase decision, and they are deemed just as reliable, and sometimes in some studies are deemed more reliable than word of mouth. So people are really gravitating towards these just because we have a very technology-centric mobile lifestyle.
Great. And one point we discussed, our expert panel before the session, is the consumer goes to Google and doesn't always find the state survey reports. And I've seen that here helping family caregivers, whereas they can easily find the reviews, which we'll talk about in just a moment. That's actually a good segue for our next topic on this webinar. So let's go ahead and move forward. Let's talk about our core strategies. And the first is to audit search. Okay, so when consumers go online, what are they going to find when they need skilled nursing? To optimize search results for your organization, you need to know that. You need to know how search engines prioritize results and how people in need of senior care resources are searching out those resources online. What most folks don't realize is that when you go to a search engine like Google, it will tailor results to the keyword you type in, but also it'll tailor the results by your location. In our last Digital Marketing Academy webinar, we had an expert who spoke on this point in depth. We have the recording and slides for that session for anyone who wants to dive deeper. But essentially, we discussed that search engines try to optimize the results they show for what they think is most relevant to that person doing the searching, such as nursing homes closest to them if they type in a general search like nursing home costs. And that's especially true if they're searching Google using their mobile phone, as Amy was very wise to reference. In fact, 50% of searches on mobile phones have a local intent, such as the person searching for a business address, the phone of a business, or driving directions, or they're searching out nursing homes near me, for example. Google also has a tool you can use to see the most common search terms. It's called Google Trends. I took a look and I found that the top 5 trends currently for nursing home searches are in fact nursing homes near me and nursing homes in, such as nursing homes in Texas, for example. Those are ranking in the top 5. Google will also tell you which keywords are starting to get a lot more usage, or what they call rising keywords. And there I found that best nursing homes near me is what's trending among those searches online for that type of care. So that means they're starting to see a lot more people search for best nursing homes near me. And reviews, the growth of reviews in the skilled nursing category is playing a role in that as well. And we'll cover that later on. We also know that consumers nowadays go online to research a business before they pick up the phone to call that business and before they'll return the call of that business. Amy, you had some insights that you wanted to share on that point. Can you go ahead and share some of that recent data that you had found about Google and search engines?
Oh, yeah, absolutely. So we are a Google partner, and so I was just on the phone with them last week, and they sent me a slide deck that they use, and I know this is data, Denise, that you've known since last year, but 90% of the buying process, overall spectrum, is already done before a person contacts a business, and that is so scary to me. You know, if your online presence is not up to par, you're losing customers already. So a lot of times, a lot of our skilled nursing clients say, well, you know, really what it's all about is the face-to-face marketing. You've got to just, you know, go bring your case managers brownies and develop a great relationship with them. How am I going to calculate an ROI on a website? That is all true, but with 90% of the buying decision taking place before they even talk to somebody, it's going to disqualify you if you don't have a great online presence. So I think that's a really important point. And the other point I wanted to make was Google Trends is a free planner that I think is very effective. Another free planner that Google has is the keyword planner with an AdWords account. You can use that keyword planner without even doing any AdWords. You just need to sign up for an AdWords account, and then you can go ahead and see exactly how many search terms, how many times best nursing homes in Texas, for example, has been searched in that month. And you can do some really sophisticated geolocation targeting where you can see how many times someone in Denver has searched for nursing homes. And so by being able to drill down really effectively and combine your Google AdWords with your Google Analytics, you'll be able to target the correct keywords pretty easily.
Great, thank you. And then we're just going to cover a few more examples, and then I'm going to turn it over to Judah to share about how he's done this audit process with one of his clients. I asked earlier, when they go online and do a local general search in your area, what are they going to find? So if you haven't done this search from your facility's computer, I recommend you do that after this session. What I found when I typed in nursing homes near me in the San Mateo office of caring.com, the top half of the search results, so most of the page that I was first seeing was ads and Google local results. Below that, or what they used to call below the fold, the bottom half included directories, review sites, and assisted living results. So do this search and see what is in your area when someone types in nursing homes near me and if you are ranking or not. And then also another search to do to audit how you're performing in online search is your business name. Do a search of your business name. When that hospital discharge planner or their medical professional gives the name of your business to them, you bet they're going to go do this search. So find out what they're going to see when they do that. Now, Judah, this is your client we're showing on this slide. Can you describe how your agency takes its clients through a search audit like this and some of the pointers you give them in that process?
Right. So this was actually a very interesting challenge for us because this particular client actually took over a skilled nursing facility that was owned and operated by an entirely different organization that had really run the facility into the ground. So this was a freestanding building in Cherry Hill, New Jersey. It was operating for the longest time under a totally different name and had developed a really, really crummy reputation online for that name. So the challenge when they took ownership and we took over the account was that before we were able to proactively go out and build out their digital footprint, we had to first figure out how to undo all of the associated negativity connected with the old business. Because Google and Yelp and all of the major pages, caring.com as well, all of the major landing pages online associated this particular address, this location, with the old guard. So they were kind of suffering the proverbial sins of the father, so to speak. And it was a challenge for us to convince Google and some of the other major search engines, as well as the independent healthcare resources online, that the new business was no longer connected to the old guard, and in fact had completely overhauled the facility and was therefore deserving of a fresh start. So we essentially shut down the old Google business page with all of the associated negative reviews and did the same on some of the other major landing pages. And then slowly, when we crawled out of that muck and the mire, we then started building out a very positive footprint, and thankfully, we've been off to the races ever since.
Fantastic. And Amy, are you likewise finding that skilled nursing organizations need help with this type of audit, and what tips are you sharing?
Absolutely. Well, Judah explained that very well. We could focus a little bit more just to augment what he's saying on Facebook. They follow fairly pretty much the same process And we can get reviews, negative reviews off. That's one of the things that people ask us all the time. Can you take this negative review down? If there is anything that is wrong about it or incorrect or inaccurate, Facebook will take it down. And Google will do the same. But a lot of times it's difficult to be able to prove that with the HIPAA laws that are in place. So a lot of times, in order to prove something was incorrect, you would have to divulge patient data, which you can't do. So, you know, one way to really kind of counteract that is to just try to get a ton of positive reviews. And then those few negative reviews, everyone will understand that there are crazies out there.
Thank you for bringing up reviews. We're going to go into depth about that, but as we're looking at this screen, if you see on the right-hand side, that is a Google Knowledge panel that appears when someone will search your business name, and you'll see in the middle of that screenshot reviews from the web. So they are showing reviews from the many review sites that have reviews about your business, and each platform is different, as Amy pointed out. But clearly, across the board, most are willing to take down a factually inaccurate review. They do not want factually inaccurate information on their website. So you need to learn the landscape, learn what is out there about your business. And another good point that Amy made is that you need to do this audit regularly. It's not a one and done. Okay, so let's move on to the next core strategy, which is optimizing your profiles and other pages online to ensure that family caregivers and older adults find great info about your business and want to inquire further. Your website is very important in helping your skilled nursing organization get found by senior care searchers online. We've also covered website optimization in some of our other recent webinars, and we have that on our industry blog. I'd be happy to send you the link afterward. But just at a high level today, your web developer or your marketing agency can also help you hone in on this success factor. Both of our experts on this webinar offer that service to their clients and can help you if your website is not already optimized for search engine. Ideally, you want your website to be on page 1 results. So those results we were just looking at the prior slides, those were all page 1 results. You want to be on those pages, whether the family member or the patient searches by your business name or via a general search. The search engine algorithm or the computer code that determines those search results changes pretty frequently. It's a tough nut to crack, but there are some basics that are tried and true. And there's also some timely guidance on this topic via a website called moz.com, which has the top ranking factors that you should focus on. Those range from having your website and directory listings in the proper category of skilled nursing or nursing home, and making sure that the web pages are consistent in how they show your business name, address, and phone. So very specific, like if you are 357 Northwest Smith Street, then it should be, and you spell it NW rather than spelling out Northwest, then all of the websites that have that address should likewise be NW. I know that seems like a small detail, but that can definitely matter to the search engine bots, if you will, and algorithm. You also want to get reputable links to your website from other websites that are already ranking well, or have what's called domain authority and are already favored by the search engines. And there's some code that you need to have on your website called schema markup, which explains simply, tells the search engine what the important content on your web pages is, and it helps it rank those pages according to the keywords of the searcher and location of the searcher. And as always, it's really important to have fresh or new content regularly added to your website as well. So on this slide, I started with a search on Google for best nursing home from my desktop computer in San Mateo. I found only one nursing home was ranking on page 1 for that general term, and it was this one. So they seem to be doing the work to optimize their website pages for getting found by anyone searching for that in the San Mateo area, which is a short drive, less than 5 miles from where they're located in Belmont. You want to make sure anyone doing a similar search in your area finds your website in those first page results, because most online searchers don't go past page 1. Okay, just in the interest of time. Go ahead, Amy. Yeah.
I just wanted to put a plug in for caring.com here, because most of the page 1 listings are larger directories like caring.com, and that's why you want to make sure you have a listing in those directories, because people are going to search there. And so having an optimized presence on Google as well as in those local directories, as well as an optimized presence to get you on the 3-pack in Google, is of vital importance. So you can't forget about those directories as well.
Thank you so much. And that actually brings us to our next slide, and that is a success factor for online search, and that is having correct representation on the web. So all the various places that has your business, you want to make sure that the information is accurate, particularly name, address, and phone. You want to claim the listings, particularly Google Local and the senior care sites. As Amy pointed out, that is where the senior care searcher is first going to go to find a provider. And you need to pay attention to the reviews and make sure that content the brand is well represented across the web. So Amy, can you share, this is one of your clients we're looking at here. Can you share how you helped your clients with this success factor and any related tips?
Yes, absolutely. So one thing that is, I think, really interesting and very important is that the quality of these reviews has to be great on Google, or else they will not put you in that 3-pack, regardless of whether you're the closest person that they're looking for, or the best ranked on Medicare. They are looking, Google, in order to get into that 3-pack, they are changing their algorithm to make sure that only businesses that are ranked 3 stars and above can even make it into that 3-pack. So that just kind of underscores the importance of the reviews in general. Claiming the listings can take a long time. So think of your review site as a mini website that needs to be done really well. One of the problems we run into occasionally is when people think, oh my gosh, how long is this taking? Why does it take me 5 days to get Google to give me access to my business after I claim it? Why does it take forever to update all of my information? And you just have to think of it as a mini website. And the images that you select for your banner are very important. And that people more and more are going straight to the social media site as mini websites rather than going directly to the websites themselves. So, people are just going straight to the source as much as they can.
Okay, great. And then Judah, is there anything else you would add on the success factor for correct representation on web? I know you covered this a bit in the prior example of how you helped a client clean up their reputation, but proactively, if there's no reputation, is there any tips that you add for making sure they have consistent, accurate information across the web?
Well, yeah, that's a great question. And really, the salient point in all of this, it's interesting for the owners and operators on this call. I know the healthcare industry, most of us are old school. The internet's a really scary place. And I sometimes get some iteration of this common theme where owners will say, well, I don't want to exist online. We don't want to be on social media. We don't want to be on Facebook. So why bother claiming all these pages? No news is good news, live and let live, and all that. But the truth of the matter is that in 2017, you really have to embrace the fact that people are going to have a conversation about you and your business online. It's not a question of if, it's a question of when. And as Amy pointed out, as you pointed out, Denise, these pages, these review sites are indexed a lot higher up on the search engines for organic results on these important search queries, a lot higher than Medicare's own website. CMS, Medicare.gov, nursing home compare feature. These are not SEO friendly sites. And as a result, they're not indexed properly, whereas all of these healthcare independent review sites are heavily indexed online and generate great organic search engine optimization. So you can't make a mistake of ignoring these pages. You have to embrace it. You have to claim it. Go through the process. Like Amy said, it might be a little tedious at first, but it's well worth the effort. And if for nothing more, and this is a very important point to make, all you need is one disgruntled ex-employee that you recently terminated, or your competitor from down the block, or a savvy, unhappy family member who wants to really do a number on you. Go online, claim your Yelp page, or build, frankly, a Yelp page for your business. Same with Facebook, with the intention of doing, with nefarious intent to do a lot of harm. And then you're as good as toast, because ultimately that page will exist in perpetuity. You will have no access to your very own Facebook page that's been claimed by your competition for the sole purpose of making your life miserable online. So if for nothing more than to try in some way to control your own destiny, you need to claim all of your landing pages wherever they exist so that you can monitor the action, so that you can respond to reviews, so that you can put up correct information and try and make sure that your online reputation is pristine.
Excellent points. Thank you both. Let's move on to the next success factor, content and conversion. Whether on your website or on other websites that have information about your business, you need to consider how well you're answering the common questions of senior care searchers. The better your online presence serves their needs, the better it will serve your business interests in converting them from searchers to customers. Photos and reviews are the most compelling for the senior care searchers online, in addition to cost information. Your website and online profile should have these items. With photos, you want images of real people rather than models, of those people you help. It can make a really big difference in attracting and converting prospects. And we'll go deeper into the reviews in just a minute, but let's first chat about photos. Judah, the images on this slide show how one of your clients is using compelling images to attract prospective residents. Can you talk about how you help them do that and any general tips you have for other skilled nursing organizations?
Sure, thank you. So Tower Lodge Care Center, great client with a facility in South Jersey. And the beauty of what you're all looking at here, folks, these are actual photographs of their own delightful residents engaged in daily living at the facility, thriving in health and in happiness, interacting with the compassionate caregivers. And I always say that we're a healthcare business. We're not selling widgets. We're interacting with people. And the generic stock imagery that you see in different industries online, it gets very stale very, very quickly. That delightful lady that exists on, 20, 50 different websites in all 50 different states, people start seeing redundancy and they recognize that this isn't your resident, this isn't your staff member, that she doesn't live with you because she can't possibly live in all 50 states at different locations. So the first and primary way to keep things real, so to speak, is to put your best foot forward with respect to your creatives, to show that you're a place where people don't just get 3 square meals a day and medication and turn as they have wounds every 2 hours, but they're also thriving. They're living there, they're engaged in activities, and they're doing really, really well. And eye candy, to see is to believe, right? So the next best thing, the next best substitute to taking a physical tour of your facility, which is a great thing. Obviously, you want everybody in the building touring with your admissions director. But before they do that, the call to action would be to showcase your facility in the most promising way using legit photographs. So for this particular client, a professional photo shoot, It's well worth the investment, in my estimation, my experience. You set up the money shot, so to speak. You make sure that your facility is looking tip-top shape. You get different kinds of photographs in different areas. Obviously, you have to be cognizant of HIPAA compliance, the issue. Can't take pictures of residents who are not consenting or not alert and oriented based on BIM scores and willing to be photographed, of course. But being mindful of all that, you do a daily a photo shoot at the facility over the course of the day, and then we aggregate the data. We put it out there online, social media, on the website, and it's a very, very, very powerful call to action. And this particular client saw tremendous engagement after we substituted the generic photographs, the actual, the real McCoy.
Excellent. Thank you, Judah. Amy, is there anything you'd like to add about how you help your clients get over the hump on photos?
Sure. Yes. One thing that some, especially people whose skilled nursing facilities still need to be remodeled, or their patients are a little bit older than they would ideally like to have, most administrators want to have a higher skilled mix, right? Where we want more Medicare patients, and so that generally is a younger audience. So what we have done in the past is we've staged a certain section for photos, and we've brought in actors that are representative of the skilled mix that is desirable for the facility. So I think that, to speak to Judah's point, I think custom photography is definitely the way to go, that showcases your facility in the best light.
Great. Excellent. Well, in the interest of time, let's keep moving forward. As I mentioned early on, we can answer your questions about any of those success factors, whether during the Q&A toward the end or afterwards. So hopefully you don't feel we're moving too fast, but we have a lot to cover. So I want to go ahead and transition. Let's cover online reviews quickly so that we have time to go into the case studies of our experts. Now on caring.com, this is my area of specialty, and we are really data focused, and we watch and track how people use our senior living directory. The data is very clear. Online senior care searchers are clicking on the list with reviews and skipping those that don't have them. So again, they're going to the listings with reviews and skipping those that don't have them. And in some cases, they trust this peer feedback more than advertising and marketing brochures. And as we showed and mentioned earlier, these reviews are showing up in Google search results. We've also done some studies, and I'll share one in a moment, that show that the volume of reviews a senior care business has can positively influence the volume of inquiries, tours, and move-ins that business gets. And we have an annual award based on reviews, which I'll discuss later, that we've seen also boost prospect engagement. In one study we did, we found that partners that had the award, on average, doubled the volume of inquiries and move-ins than those partners that didn't. So reviews are having a huge influence on research and selection process of the senior care searcher. Super imperative that you get reviews of your business. I recommend that you target at least 10 initially and then get 4 per year thereafter at a minimum. Now, it can seem daunting. What I just recommended may seem daunting to you. There's a lot of review sites to choose from. I recommend you focus on the ones that are most visited by the people in your target customer base, and also the ones that they most trust. So I mentioned we focus on data. Last summer, we did a survey of family caregivers and older adults who had used the internet to research and select a senior living community. We specifically asked them which review sites they used in that process and which ones they most trusted. Very few trusted the social networks for reviews. They didn't believe that those had good filtering programs, or that that a lot of those reviews were from real consumers just like them. And they also, weren't as trustworthy of the general sites like Yelp either. They get millions of visitors to those sites, and they're great for restaurants, but not necessarily for senior care. The ones that this audience most trusted were the senior care sites, and that makes sense because, for instance, at caring.com and some of our competitor sites too, we have humans looking at those reviews. We have expertise in the area. We understand the nuances of the feedback being given. So that is likely why they trust the senior care sites most of all. But also integrity. I cannot hammer this point hard enough. Integrity matters a lot. They want to hear from other consumers like them. They're not as much interested in employee reviews. There are websites that focus entirely on that, like Glassdoor. You can get recommendations on LinkedIn from professional contacts. But for a senior care searcher looking for a nursing home for a loved one, they don't want to hear from your employee that it's the best place ever. They want to hear from your customers that it's the best place ever. And then also a common question I get is, why should I bother responding to the reviews that I get? So I asked family caregivers this question as well. Do you care? Does it influence you if the business responds? They do. Almost a third said that it lets them know the business cares and is listening. But some said, you know, I don't think I've ever seen a business respond to a review. So that's really a missed opportunity. And then there's also a segment that says, you know, it's going to depend on what that business says, whether or not their response to a review influences me. So the takeaway here is definitely respond to reviews. The most people, it does make a difference. And it also, takeaway is be mindful of how you're responding, because that too, sometimes that can be more persuasive than the review you received. This is my #1 tip I give people when responding to reviews. That reviewer, their mind may be made up, but those other visitors to that listing online who read that review, there's still an opportunity to influence their opinions of your business via the response. So imagine your response is on a billboard over your local highway. It's going to be seen by a lot more people than just that reviewer. Keep the crowd in mind when responding, and we're going to go into some tips for that. When you get a positive review, be sure to thank the reviewer. That can go a long way. Be authentic and conversational. You can also complement the information they referenced with some business info, some facts that support it. They say your food is great. You can say, you know, we work really hard to have a diverse menu of healthy options. You know, that's a way you can complement and expand on the information to market your business. Very important in skilled nursing that your response not divulge confidential information. HIPAA definitely matters in these cases. And caring.com, we filter the responses before we publish them. We do our best to make sure that no confidential information has been breached. Now, when you get a negative review, as Amy said, find out, take a look at that review. Are there any fact errors? If there are, find out the policy of that review platform for getting that review taken down and pursue removal. If it's just a difference of opinion though, you should take the opportunity to respond. Be empathetic. Don't reveal private info, just like what we talked about. If your business has made a mistake, some businesses are willing to acknowledge that and mention the corrective action that they took. You don't need to go into a lot of detail. In fact, I recommend you not go into a lot of detail, that you take the conversation offline. And also, as Amy mentioned, get positive reviews to balance out the negative feedback. And also keep in mind, when someone sees only positive reviews, they're going to find that hard to believe. When they see a negative review and a batch of positive reviews, they're going to take it all in stride. They're going to believe your business is not perfect, and they want to see what's the worst thing people are saying about you and how did you handle that information? Did you handle it gracefully? What if they have a complaint in the future? Are they going to be able to approach you about that complaint? Now, Judah, I've worked with you on helping your clients respond to both positive and negative reviews, and I've covered some of the tips here that we've talked about. Are there any additional tips or insights that you think are important that I haven't covered for responding to either positive or negative reviews?
I mean, I would just, in summation, you've covered the basic points very, very well. I think really it is a three-step process. The first order of business is to try to look at the review objectively, and if it's a review that doesn't make sense, that isn't deserve it, after all of your research as a facility to get to the bottom of what transpired, you can argue for full removal. There's no substitute for that. And sometimes you can use the very specificity of the poster and what they've written to argue for removal, because like you said, Denise, there are rules and regulations and guidelines, and nobody wants to have or host defamation or defamatory content on their website. Slander, libel, those are not acceptable. But you have to be able to prove that. So there's no substitute for full removal. But if you can't get a review removed, because ultimately everyone's entitled to their own subjective opinion and to post their experience, then you have to respond, as you correctly pointed out, and as Amy pointed out. And when you do respond, you're not responding to engage in a shouting match with the poster, because you always lose. I mean, even if it's a perceived injustice, we know that the consumer is always right. You're not going to win that poster over. Sometimes you don't want to. Maybe that's your customer from hell. Maybe that's that family member that you actually want out of the building. But you're responding for all the future readers. So you do it in a very even measured way to inject the balance to every equation, to acknowledge their ability and their right to express their own subjective opinion as it relates to their personal experience, to validate them for that, and at the same time, to errors to be human. So you take ownership of your own failings, you make things right for the customer, and you try to win them over, and you respond for all future readers so that they see that there's somebody watching the house, and that you really do care. And then the third item on the list, as Amy mentioned, is to build love. There's no substitute for that, because as you work to build your profile online and to pour love in terms of positive feedback and reviews, wherever you possibly can in cyberspace, Google begins to suppress the previously existing negativity. So the older reviews, the ones that are really bad, that are doing irreparable harm to your business, that exist on page one for your buzzwords and your keywords, as you build love on top of those really nasty reviews, you start pushing those reviews down further and further in the organic results where they become buried. And so what I always tell my clients is, I'm not a magician, Amy's not a magician, none of us doing this can promise a client that will always be able to remove a negative review. We work very hard at it, we're pretty good at it, but if you can't, it'll exist and it'll sit there like a bad scab for forever, and no self-respecting agency should be able to convince anyone that they can get them removed. However, if they can help you suppress the negativity by working together with you, hand in hand, to build love using legit reviews from your happy customers wherever you possibly can online, you start pushing down and stifling the negative reviews, where ultimately, if they're buried on page 582 for your bread and butter keywords, then for all intents and purposes, they no longer exist and they no longer have that potential to do you harm because nobody's seeing them. And that's why it's such an important exercise.
Thank you, Judah. Amy, did you have any additional quick thoughts on this as well?
Yeah, just to support everything Judah said, and I have a funny story about his point that we're not magicians. I had a client who swore up and down that he had a brother that could get the reviews just removed, right? He could get like a negative, I think it was a negative article pulled off of Google, right? And I was like, well, short of, like, I don't think you can force that to happen. I don't think you can just strip Google, right? But he swore up and down. So I thought, okay, I'm going to go down this rabbit hole with you. And there might be something I don't know about this. And so let me see. So I went in, and this brother was a sheriff. He was a detective that worked in the police department. And he had experience with taking negative content off off of the internet. And I said, okay, under what circumstances can you take negative content off of the internet? And he said, the only time we can do it is when there is a restraining order, or if they've got like some police executive order out there. So if there's a review site that calls you and tells you that they can strip your negative reviews off, or they can take your negative content down, that is not correct. The only thing that you can do, like Judah said, is you can just push it down and replace on the first page or the first several pages, the positive.
Okay, great. I want to make sure we have enough time for the case studies. Thank you so much, both of you, for those insights. Great stories, great insights. We talked about getting reviews. Nearly every review site has a way that you can grab the link to submit the review. Here's an example from caring.com. You just go to your listing, you click the write a review. There's a special URL that you can give. You can email over to your cognitively healthy residents and their family members to get them to publish those reviews. This is the quickest, easiest way on caring.com to get reviews. Each platform's different. Find out what's available for the ones that you're focusing on. A lot of the websites also have partner-only services. So, for instance, on caring.com, our referral and advertising partners can have postcard reviews, phone reviews. There's also digital agencies and software you can use to get reviews and build your online reputation and monitor, etc. So find out what's available. Both of our experts can take you through this. They're both well-versed in the universe of online reviews. Just to summarize what we've covered in the online review space, build a collection of great reviews, number 1. Number 2, respond to the reviews you get. And number 3, continually monitor for new reviews. And that may sound onerous, and you may consider working with an agency like those of our experts. Okay, now I'm really excited. Let's get into the case studies, because in addition to those we've shared, both of our experts have some great information to share in the final moments of our presentation. I mentioned that reviews are influencing senior care searching online. This is one case study. We looked at, this partner had over 100 listings on caring.com. We looked at their listings that had 15 or more reviews compared to those that only had 1 to 2 reviews. We found that those listings that had 15 or more got 5 times more leads, 7 times more tours, and 8 times more move-ins than their listings that only had 1 or 2 reviews. So that really builds the case for the importance of having real consumer reviews and a high volume of them. Now, Judah, you have about 5 minutes. We want to make sure we save time for Q&A. So go ahead and take us through this case study, and then we'll talk to Amy about her case study.
Okay, thank you so much. So this is a great client of ours. They have a top organization with several facilities across the state. One particular location of the case study here is the Grand Rehabilitation and Nursing at Queens, in Queens, New York. They have a fantastic post-acute stroke center. It's the only one of its kind in the entire region. I'm not talking here about an LTAC. I'm talking about a step-down post-acute specialty care center dedicated to stroke patients and their recovery. And it was the best kept secret in New York. And the reason for that, a number of reasons, but first and foremost, Google just didn't know that this particular component existed. So the first and most important way to generate traffic for this kind of effort is with content. There's an age-old expression online that content is king. Google loves quality content because there's no perceived agenda to sell something. If you look at the lexicon, probably the quintessential definition for Google is that it's there to empower user search. So whether you're looking for information on products or services, Google wants to give you relevant results for whatever it is that you're looking to figure out. Not spam, but relevant, empowering results. And that's what blogging is all about. In this first slide, you're looking at the on the left-hand side, the snapshot is a blog, an article that we wrote, was one of several. We wrote some articles. We had the local news agencies, they had them come down for a ribbon cutting ceremony and subsequent write-ups. But in all cases, we put content online to promote this program. And the Google spiders, when they went crawling the internet, re-indexing and looking for content, they found this stuff. And as a result, they promoted this for these search term permutations. And that's the first and best way to generate high octane traffic, is to simply talk about it, empower people, let them know that you have the program, and let them know this in very strong declarative terms online in the form of consumer education. So that's this slide that you're looking at. And of course, on the right-hand side, that's just a picture of the unit itself at the facility. Denise, if you wouldn't mind, the next slide, I think we have a picture of a review on caring.com. So this review was posted on July 6th of 2017. And this kind of harkens back to what I think Amy pointed out at the beginning of this webinar, and very correctly, is that the review sites for your bread and butter keywords, folks, these review sites are where you're going to see a lot of great search engine results for your facility search terms. So the next thing we did in this case study is we said, okay, we got the gospel out. We put up some really quality pieces out there online, press releases, articles, blogs, talking about the stroke center at the Grand. But now we want to also engage with our happy clients, with the families who've had a great experience at the facility for stroke rehab, to go back online, post their experience on some of these websites, so that, number one, the people looking for this level of care, for this specialty care, will find these reviews right away, leveraging the incredible goodwill and the power, the traffic power of a site like caring.com in the search engine results pages. And so there's a duality of purpose there. Number one is to generate traffic, and number two is to showcase the fact that we don't just have the specialty program, but we're pretty good at it too. So that's what we did. So we specifically went out looking for these happy families who had a rehabilitative experience at a facility for the stroke center, and asked them if they wouldn't be, they'd be kind enough to go online, post their experience. And so they did. And if you go and you Google any conceivable permutation, don't take my word for it, but you can do this exercise over your folks afterwards, related to stroke rehab in Queens, any permutation thereof, and you'll find caring.com's link way up on the top of page 1 in the organic results for this particular review. And that's how powerful it is. So it's essentially the equivalent of a blog, but it's a review.
Fantastic. Thank you, Judah. Now, Amy, you have a client case study you'd like to share as well.
Sure, I will be really fast. If you want that, basically the take home is exactly what Judah said. And so if you want to just go to the next slide, one thing that I did.
Before we move to the next slide, what I really loved in seeing this case study was you're encouraging them to use clever text. I know some folks think that there's no room for clever and being creative in our industry. There most definitely is, and you've given them an excellent example here of how you can be creative and clever.
Well, thank you very much. The one thing I did want to say is that Facebook advertising may not be trusted, but it has yielded such a positive ROI for us that it's incredible. So this one client spent $1,000 in ads, and it yielded about $50,000 in revenue. So they are continuing this advertising with us and with great results. So this, when you combine the clever text and the images and a little bit of ad spend, Facebook can really generate patients for you.
Oh yes, and just to clarify, the data I shared was specifically to reviews. I agree on Facebook advertising. It can be a powerful tool if you have the budget for it. Okay, Amy, and then you want to talk about this as well?
Yes. So basically, just kind of more of the same, that caring.com, you should have really active reviews on a review strategy on caring.com, Yelp, Facebook, and Google. If you have those 4, you will be pretty well covered. It will also help you rank higher in on your SERPs. And then the one other thing I wanted to say is that content, if you continually generate new content and put a new post on your Google My Business listing every week, that will rank in the SERPs. And so that fresh content will help you increase your overall profile as well.
Fantastic. And then if folks have any questions about Amy's case study, I know we're short on time, but she's available afterward. Now let's answer some of your questions. Just one moment. Let me pull those up. Okay. Here's a question for both of you, and we'll start with you, Judah. Do you have any suggestions on overcoming the healthcare environment of referrals being slow from hospitals? My approach is to heavily brand outcomes of patients they referred and making that a top priority of marketing. What else have you found can help?
Again, can you repeat the question? I'm not sure I understand it.
Yes, she's asking, you raised a great point about the industry shift and referrals slowing from hospitals. This person has been focusing on the marketing the outcomes of patients that have been referred to them, but they're wondering what other suggestions would you recommend to counter that trickle?
Right. So what I'm telling my clients is right now we all have to start engaging in the low-hanging fruit. What I mean by that is we got to all start being creative about reaching out to new and unique referral sources. So I'll give you a couple examples. Let's say your particular SNF, you guys accept Medicaid pending. Not everybody does. Some people can afford to be selective. As soon as patients plateau off of Medicare or they run out of days, they send them home. If they can't go home, they tell them we don't have Medicaid pending availability, and they got to go to a different facility. But let's say you're one of those facilities you accept Medicaid pending. You should have your screeners, your admissions director, your marketing person develop relationships with your competition, your competitors in the area who operate skilled nursing facilities who don't accept Medicaid pending, and get them to discharge those patients who cannot go home, need to be in a facility at the end of their Medicare time, develop a symbiotic relationship where you can accept those patients on Medicaid pending, fill a bed, and develop your census that way. That's one example. You should look at your 30-day discharges. You know that you send folks home. Sometimes they're jumping the gun prematurely. They'd like to be home. They really could use additional time under Medicare to rehab. There are additional goals that can be met, but they go home and then they have buyer's remorse. You should have your social services contacting within the 30-day readmission window to the facility so that if they think they need to come back, you can still bring them back in on Medicare and skill them, pick them right back up from home, utilizing the same qualifying hospital stay that you did when you took them initially from the hospital. You should also be, frankly, talking about keeping referrals for patients that the hospital sent you that ultimately went home from the hospital, choosing instead of going to a facility to be home. Maybe they have remorse after they get home, realizing that they probably should have been in a subacute environment first. Call them within the 30-day window, and you can bring them back from home and pick them up on Medicare. Develop relationships with assisted living centers so that if you get referrals and they're not appropriate for a SNF level, they're not a two-person assist, they don't require certain help with ADLs that would necessitate skilled nursing level of care, send those folks to the assisted living, and in turn, when their residents have a knee replacement surgery and need post-acute care, have them come to you for their rehab. So these are new and creative means that maybe in the past we tended to overlook because we had a steady stream of referrals coming to us via Allscripts, pure span right from the hospital. Because of the factors we enumerated earlier in terms of the referrals drying up, not being as robust as they were in the past, these would be good ideas to try and develop your census.
Great. Amy, did you have anything to add?
Yes, just two things. Those are great suggestions, Judah. And I would just add that one thing that we've done to help generate additional business is in an online environment is live chat. So we do live chat all day, every day for about 300 clients and facilities, and it's been great. So not only is it a great way to generate new business and to get bed referrals, but it is also a great way to help with the customer service, because as you know, your nurses and your staff are busy in the skilled nursing facilities, and they're not always able to answer the phone. So we have had so many times people buzz in on live chat saying, hey, we just really need somebody to come in. My mom fell out of bed, and or she's been buzzing her buzzer for 10 minutes or whatever, and we can respond immediately to that. And so that's one thing to help keep the word of mouth positive. Another thing is that on the tail end, we do surveys for afterwards, like about between 3 and 7 days after discharge, to help with that 30-day period that Judah was talking about. Not only to help them come back in if they need to, but also for litigation prevention. So it works very well on both ends. And then the third and final thing I would say is you have to remember that digital is not an either. It's not either digital or traditional. It's not an either or. It's a both and. So you have to, in order to have a great experience, you have to bring in a postcard that says we're on live chat and go show the case managers. That's the easiest way that I can explain how integrated your marketing has to be, because you use a digital print asset to showcase a digital asset in an in-person format to develop a relationship with a case manager. And that kind of strategy has worked really well for a lot of marketing directors.
Thank you so much. And I'm really sorry, folks, that we've gone over a bit. We got a couple questions. We'll definitely answer all the questions we got in follow-up to the call. We got a couple questions on reviews. I'm going to quickly answer those. There was one question about if you get a whole bunch of reviews in a short amount of time, some of the review sites will disqualify them, thinking that they were solicited or fake reviews. And what advice do we have around that? You are absolutely right. Some of the review sites and the examples that you gave were Google and Yelp are using algorithms rather than people to filter reviews. And sometimes those algorithms err and flag real reviews as potentially solicited and hide those or archive them. On caring.com, we also take a look at that. You need to put yourself in the shoes of the person on that listing. If they see a batch of 10 5-star reviews all posted on the same day, yeah, they're going to be really skeptical that those are real reviews. And Carrie.com, we take it in case by case. We have other filters that we use in looking on the back end on analyzing those reviews against our guidelines. If necessary, our human staff will follow up with those reviewers, collect a little bit more information about their real identity, and confirm that that review is within the guidelines before publishing it. I do recommend that you not line up all your residents and have them all post reviews at the same time. It is highly likely you will encounter the situation you described, and the strategy that you outlined of having your local administrators only solicit a few a week, that can be a great strategy for overcoming that as well. The other question that we got was, Amy, you referenced that 90% of the decision is made before they call. What was the source of that statistic that you shared?
That was directly from Google in a Google presentation that they sent me last week. So I can screenshot it and show you, Denise, if you want, but that was directly from the hotel.
That's what I thought, yeah. So that question for that person who asked that was data directly from Google. They do surveys and also have an enormous amount of data on people who are searching online. And then the other stat that we shared, about 80% of consumers trust online reviews. I can pull that study and send that to you afterward so that you have direct access to that as well. Okay, so I'm really sorry that we didn't have more time for questions. I just want to cover a few more announcements before we go. And again, I thank you for staying with us, folks. Let's just summarize the key takeaways. Recognize and seize the opportunity of online marketing for skilled nursing. Our experts have given you lots of examples of how it can work for your business and why you should pay attention, and how it's not an either or, it's a must do. And then once you face that fact, optimize your online presence as soon as possible, get found in those search results, and monitor and manage your online reputation via consumer reviews. Super, super important in driving those searchers from curious to customers. Now, I have a really important announcement. I'm so glad you're still on the call to hear this. I mentioned earlier, we have an award for the best senior care providers based on reviews. At the urging of Judah Gutwein for Caring Stars 2018, we are going to include skilled nursing for the first time in the history of this program, which was the first of its kind when it was launched in 2012 and has since generated a lot of positive content, media coverage, and social media buzz, in addition to boosting staff morale at those communities who win the award. Make sure your skilled nursing community qualifies by September 30th, and you can do that by seeing how many reviews you have, making sure they're positive, and getting in touch with me afterward. We can discuss your current profile and whether or not you're in the running for Caring Stars. Now, I hope you will contact our guest experts afterward and go in more in depth with them on the excellent insights that they shared. This is their contact information. This will be emailed to you afterward, and you're going to be prompted at the end of the session whether or not you'd like to be contacted by them for continuing the discussion. Please answer yes, and then they will contact you to answer any questions that you didn't get answered during the session. You can also reach me, Denise@caring.com. This is my telephone number here. Please don't be shy. Reach out to me. For reviews, though, please contact our reviews team at community@caring.com. That's community@caring.com. We are so glad you spent time with us today to hear this presentation. We really want to hear your feedback. We're going to prompt you to rate this session as soon as I end it. I hope you will take that survey and let us know how we do. Did we cover the important topics you want covered? Any suggestions for us to improve? And if you miss it right after the call, you'll get a prompt in an email in about an hour. We look forward to hearing from you. Thank you so much, and thank you to both of our experts. Thank you, Judah. Thank you, Amy. Did you have any final comments you wanted to say before we close?
Just make sure you register for a profile on caring.com. That's my plug. I think I have had such a great experience with the clients that we have worked with on your platform, and thank you again for the opportunity.
Thank you. How about you, Judah? As well. Okay, great. Okay, well, thank you, everyone. I hope you have a great rest of your day.